Medical malpractice claims can be asserted against any healthcare provider, including physical therapists. This case study involves a physical therapist insured through Healthcare Providers Service Organization and CNA, working in a PT office setting. The patient, a 32-year-old man, underwent an arterial bypass procedure on his right leg for popliteal artery entrapment. On evaluation, the patient had a complex medical history that included morbid obesity, diabetes, and chronic leg pain. His social history revealed that he had a sedentary occupation, smoked a pack of cigarettes a day, and occasionally used alcohol. Due to the patient's size, post-surgical pain, and numbness, he had difficulty bearing weight on his right leg and used crutches to ambulate. He was on several pain medications, which included hydromorphone, a nonsteroidal anti-inflammatory, and Lyrica. The patient attended 3 sessions of physical therapy. The insured physical therapist used a transcutaneous electrical nerve stimulation, or TENS unit, on the patient's right leg at the end of each session for pain relief. The physical therapist adjusted the intensity based on the patient's comfort level and asked the patient to let her know if the TENS unit caused him discomfort. However, the physical therapist failed to complete a sensory test before using the TENS unit on the patient. Appearing to be pleased with the nerve stimulation, the patient reported that the TENS unit brought feeling back into his leg and made him feel better. A review of the case study so far reveals the following. Following an arterial bypass procedure on his right leg, the 32-year-old patient was prescribed physical therapy for 3 months. A physical evaluation revealed a complex medical history and comorbidities, a sedentary lifestyle, and the usage of several pain medications. A TENS unit was used by the PT on the patient at the end of every attended session, and the patient was asked to communicate any discomfort. The PT adjusted the TENS unit intensity based on the patient's assumed comfort level. The patient appeared pleased with the nerve stimulation. Before treatment, consider the whole patient and not just the patient's diagnosis at the time of therapy evaluation. Be aware of the patient's medical conditions and any additional risk factors that may affect physical therapy. What if the PT had discussed or consulted with other providers about the patient's comorbidities? Was the patient's skin and neurological status deemed appropriate for use of TENS? What if the PT considered other therapy treatments for this patient besides TENS, such as activity to reduce obesity, quitting smoking, exercise or diet changes to reduce diabetes, or other training to reduce pain and improve mobility? Always consider the precautions of using TENS or other e-stim type machines. Evaluate patients, reassess as necessary, and document any findings. After a completed session with the TENS unit, an incident occurred. When the physical therapist took the TENS pads off of the patient's leg, she noticed 2 round red marks that appeared to be burns. Neither the patient nor the physical therapist believed the burns were serious enough for a visit to the emergency room, so the PT proceeded to apply antibiotic ointment to the burns. Additionally, she advised the patient to follow up with his medical practitioner if needed. The physical therapist checked the TENS unit and it appeared to be in good working order. However, the pads of the unit were worn and could have been the only possible source for the burns. A review of the case study so far reveals the following. Following a completed therapy session, the PT noticed burn marks on the patient's leg. The patient and the PT did not feel as though the burns were severe enough for a hospital visit, therefore antibiotic cream was applied, and the patient was advised to follow up with his medical practitioner on an as-needed basis. However, it should be noted that it was not within the PT's scope of practice to diagnose the burn or provide treatment. What if the TENS unit was checked before each session? Proper inspection of all equipment day to day is critical in preventing any patient injury or illness. The PT should have inspected the TENS unit or referred to another PT if she was not comfortable using it. However, she could have feared she would appear incompetent or feared termination. What if the patient had been monitored every 2 minutes during treatment? The patient should have been monitored during application. The patient should also have been advised of what to expect and what not to expect during treatment. Proper training for all staff regarding all equipment and written policies and procedures for any adverse events could have assisted the PT in her decision-making. The day after the incident, the patient called the PT to inform her that he needed to seek medical attention from his practitioner because the burns were looking worse. After the visit with the practitioner, the patient revealed during a follow-up call to the PT that the burns were serious. He was diagnosed with third-degree burns and would need debridement and skin grafts. The patient continued his physical therapy as much as possible, but it was complicated due to the treatment of his burn and subsequent pain. 2 months after the incident, the patient was diagnosed with reflex sympathetic dystrophy, RSD, experiencing temperature intolerance, excessive sweating, stress, and insomnia due to the pain. The RSD symptoms also prevented the patient from working. As a result, he and his family lost their health insurance benefits and suffered potential bankruptcy. The patient pursued a claim against the PT as well as her employer. A review of the case study so far reveals the following. Following the incident, the patient needed to seek additional medical assistance for his injury and was diagnosed with third-degree burns. The patient attempted to continue his physical therapy but was in pain due to the burns. Furthermore, the patient received a diagnosis of RSD, with its symptoms affecting his daily life. The patient ultimately pursued a claim against the PT and her employer. The claim was difficult to defend due to the absence of written policies and procedures, the PT's failure to complete a sensory test before using the TENS unit on the patient, as well as her lack of training on how to appropriately use the TENS unit. During the insured PT's deposition, she stated that she knew how to use a TENS unit from experience, but had never received any formal training from her employer relating to the use of the device or the manufacturer's guidelines. Based on her own experience with TENS units, the PT believed that the intensity of the TENS unit is up to the patient and noted that if the stimulus was painful to the patient, she would certainly bring it down. It was the defense counsel's opinion that the care and treatment of this patient by the insured PT was within the standard of care, specifically the use of the TENS unit. The burns, which were serious and required several debridements, were noted immediately after the TENS unit was taken off this patient and would make liability in this matter hard to defend. In general, burns are difficult to successfully defend in malpractice claims because in most cases the injury can clearly be traced back to the actions or inactions of the physical therapist. The possibility of a defense verdict in this case was deemed to be less than 20%, and the defense counsel assessed the potential exposure or claim value of the case as being between $750,000 and $1 million. A summary of the legal implications for this case study reveals the following. Due to lack of written policies and procedures, the claim was difficult to defend. From the perspective of the PT, even with lack of training from her employer, TENS was used due to positive response from the patient and the good outcomes noted. While the defense counsel's opinion was that the PT was within the standard of care, due to the low possibility of a defense verdict coupled with the high potential exposure, the decision was made to settle the case prior to trial. The total incurred cost to defend and resolve the claim was $750,000. Be aware of the high risk of burns from certain commonly used treatments and interventions, such as hot packs, paraffin, cold or ice packs, and electrotherapy. Ensure that each of these treatments is clinically appropriate and that there are no clinical contraindications for their use. Evaluate and document each patient's skin integrity, neurological status, and ability to perceive pain or discomfort and convey problems to staff. Evaluation should be performed prior to the course of treatment and periodically thereafter. Closely supervise and/or monitor patients during treatment, including frequent skin checks. Discuss any perceived alterations in skin integrity with the referring practitioner and healthcare team. Routinely test, monitor, and log temperatures of hot pack warmers, paraffin tanks, and other equipment in accordance with facility policies. This completes our case study on improper performance using therapeutic exercise and failure to monitor patients during treatment. We encourage you to stay current in your practice by visiting HPSO.com.